Welcome to Healthcare 101. With the increased attention that healthcare has received over the past few months, I thought it would be nice to share some of my insights from years of working in healthcare to help others gain a better understanding of some of the issues. The first thing you should know is that healthcare in the United States is out of control. There really is no other way to say this. In 2015, national healthcare expenditures reached $3.2 trillion. dollars. Yes, that's trillion with a T, or almost 18% of GDP. That means that for every dollar spent in the United States, 18 cents of that is spent on healthcare. That's more than we spend on military, automobiles, and electronics combined. The media knows that healthcare is out of control, and Washington knows that healthcare is out of control. That's why there has been so much debate about the Affordable Care Act and the newly proposed American Health Care Act. Both of these pieces of legislation aim to control the issues plaguing our healthcare system right now. While both of these bills were well intentioned, they failed to resolve the root causes of the problems with the system, and in doing so, continue to leave America with a failing system. The Affordable Care Act aimed to control healthcare costs and expand access to healthcare coverage through exchanges and government subsidies. In order to measure their success, politicians focused on the uninsured rate. They chose to focus on the uninsured rate because it was an easy thing to measure. Unfortunately, the uninsured rate was only a symptom of the greater problem. The creation of exchanges and increased government subsidies gave many people the opportunity to buy insurance, and uninsured rates decreased dramatically. This was a huge step forward because it meant that some people who were not able to buy insurance in the past now had the opportunity, but it failed to correct the system as a whole, and in many cases, the Affordable Care Act exacerbated the other problems in our system. The only reason that the uninsured rate was a problem in the first place is because the rising costs of care made it increasingly harder to pay for insurance, while at the same time making it increasingly harder to afford medical treatment without insurance. The measures taken through the Affordable Care Act meant that people who could not previously afford insurance now had the ability to buy it. However, these subsidies increased taxes, and new rules and regulations increased out of pocket insurance costs for individuals that had insurance before the bill was passed. At this point in time, many of you might be saying, well, at least they did something. At least people who couldn't afford insurance now can. I'm not saying that this is a bad thing, but what if there was a way that we could provide health care to our entire country without increasing taxes or insurance premiums? What if we could have our cake and eat it too? You might think that this is a pipe dream, that the world simply doesn't work that way. But actually, outside of the United States, that is exactly how it works. You see, healthcare is expensive, and in America, we've pretty much just accepted that as a fact of life. That $3.2 trillion dollars that I mentioned before equates to about $10,000 per person per year. What many people don't realize is that of that $3.2 trillion, dollars, the government pays about half. To give you an idea of how that adds up, the amount that is already spent by the federal and state governments on healthcare is more than what is spent on Social Security and federal military spending combined. But it doesn't have to be that way. Healthcare spending in every other country is dramatically lower than what we spend in the United States. In fact, the US spends more than twice the amount per person than the average of other developed countries. Sweden and Germany, for example, spent only about $5,300 per person in 2015. France came in below that at only $4,400. And the United Kingdom and Japan did even better, spending only about $4,100 per person in 2015. You might be thinking right now that this is all well and good, but money isn't the only thing that we care about when we talk about healthcare. I mean, you get what you pay for, don't you? And we pay more in the United States because we get better care. If that were the case, it might be worth spending the amount of money that we do. Unfortunately, while there might be some advantages to having a more free market system, the higher costs associated with our healthcare system do not equate to better healthcare outcomes. One of the easiest ways to measure success in healthcare is to look at life expectancy. According to the World Health Organization, the life expectancy in the US is around 79.3. This ranks the United States in 31st place in the world, well below Germany, Sweden, France, the United Kingdom, and Japan. Life expectancy is not the only way to measure the success of a healthcare system. Experts have different opinions on how to measure the effectiveness of healthcare, but regardless of how you measure it, the United States comes in near the bottom of developed countries. So, up until now, we've established that the United States spends a lot of money on healthcare. And we've established that all of that extra money doesn't necessarily equate to better care or better healthcare outcomes. So, what do we do about it? Should we just adopt the models that the United Kingdom and Japan use? After all, if we were truly able to replicate their results, that would mean that we could implement universal health care. Think no paying insurance premiums for anyone without increasing any taxes. And we would get better healthcare outcomes. Wouldn't that be great? Well, that would be great. And many people have suggested just that. But it's not that easy. The United States is very different than any of these other countries. We are much more spread out than these countries, and our population is very different. So it's not as simple as just copying what they did and hoping for the best. The good news is that it is possible to get the healthcare outcomes that we see in other countries while dramatically lowering the costs associated with this care. But it will require major changes in our current healthcare model. Over the next 12 weeks, I will be discussing 6 of the biggest failures of our current healthcare system and what we can do to not only eliminate these failures, but turn them into successes. Tune in, or better yet, subscribe so that you don't miss any upcoming videos to learn how to make our healthcare system better.